Good morning, child welfare. It is Friday, November 6th, and I'm coming to you to talk about and describe some practice changes that we are going to make in response to the rising cases of COVID and our county turning to the high risk orange level on the COVID dial. Please reach out for clarification on anything that's said. We know that this is an ever evolving situation. I'm asking for some patience and flexibility, but this first round of practice changes we are hoping will create some more distance between all of you and the possibility of being in contact with COVID, still knowing that we are charged with safety, permanency, and well-being of children, youth, and families that were being served. So we're just going to get right into it. First and foremost, all court appearances need to be done by WebEx unless a directive is given by the court to be in person. The in-person hearings will more than likely still be shelter hearings, and I'm asking that all social case workers connect with their county attorney of record. So I believe there's going to be more orders sent by the Chief District Court Judge Brian Flynn today that could take us out of shelter hearings. There's already been one order that all jury trials for the rest of 2020 are going to be moved to 2021. We're still figuring out what that means for TPRs and adjudicatory hearings. And I have been in very good contact with Jeremy Savage, and I have a set conference call with him later this morning and could get more information on that. In-person monthly visits with foster kin, children and youth, and parents that have no safety issues, their placement is not at risk to disrupt, have not been returned home in the last 30 days, or are on a current safety plan, will need to be done virtually. Family coaches have the ability to meet with families where there is a high risk of out-of-home placement, and this type of in-person meeting must be approved by our supervisor. So folks, we are going back to where we were in April. We are going to use the waiver and those ongoing visits where the case doesn't fit into those buckets that I just described need to be done virtually. Please reach out to the families that you're working with and let them know that you'll be meeting with them virtually. I am also hoping that you will increase your contact with families virtually. So because we won't be driving around as much, please utilize some extra times to potentially reach out to your foster and kin homes, your children and youth and out-of-home placement and parents multiple times while we are scaling back our in-person. Program Area 4 responses, including court order assessments, are to be done virtually when the safety of a family and community do not appear to be a concern. And if you feel it falls into this, a supervisor must approve not meeting a response time on our Program Area 4 responses. We are taking this calculated measure. We know we will be out of compliance with response times. I had a lot of conversation with other directors around the state that are taking the same type of measure. We don't feel it's going to impact that population as they are able to self-protect. And a lot of the Program Area 4 assignments are services assessments and don't necessarily have to do with safety. Please consult your supervisor if you feel like you have a Program Area 4 assessment that falls into this category. If foster or kin home want to travel outside of Mesa County and want to take the children that are in our custody with them, they need to provide a plan to the PRM and the case manager on how they will be meeting the Mesa County public health order and the public health order of the county that they are traveling to. So again, we're not restricting, but we would like to see a specific plan that we can talk to parents about, that we can talk to GALs about in and around how they are going to be safe. So for example, if a foster or kin home went to go camping, we would hate to restrict any type of travel at this point, as the camping would certainly meet all the standards of a public health order. If they are planning to travel to Denver for a big Thanksgiving dinner and they are going to be over the 10 person amount and cross household a dinner, so bringing 3 and 4 multiple households together, that would be in violation of the public health order, and we would probably not approve that travel. One-on-one therapy needs to be done by telehealth unless there is a concern of suicide and or self-harm, or a youth is at risk of placement disruption. So I'm asking the therapist to move this level of therapy to the telehealth forum. And again, this is just for a 30-day time frame. We now have eye protection that is available. Assessment workers and after-hours workers that are making appropriate response times and need to conduct face-to-face visits to ensure safety are now expected to have eye protection. Assessment workers have already been given eye protection that we have purchased. It's in your cubes. It was handed out late yesterday. After-hours response workers, please email me that you need a set of those, and I will deliver those to your cubicles. This is just a reminder that monthly visits are still required per Volume 7. The directives that I have just been given are an alternative to an in-person monthly visit and is an imperative that you document in trails the COVID concern when doing a virtual visit. Parenting time is still as is in regards to delivering and offering this service. We have an agency-wide collaboration meeting early next week or middle of next week in order to address this issue. We know Ariel is looking to scale back who's available to be in the room. They're looking at some alternative ways in order to keep their staff healthy. We will stay in communication with them and deliver any information out to you that is needed. Okay, folks, I know this was long. I'm also going to send all of this in an email. Again, we're open to any questions or concerns. We have vetted these out with Child Welfare Executive, Child Welfare Leadership, and our senior leadership team, and these have all been approved. I would appreciate if you could put these in play as soon as possible. If you've had an in-person meeting set today and you feel it's necessary to do that, please wear your proper PPE. I would prefer you move that to virtual if you can. We will stay in touch with you guys as much as we possibly can, and transparency and the safety of staff, children, youth, and families continues to be the lens that we are making decisions from. I appreciate all of your guys' time and efforts. Please be safe. Please adhere to the public health orders in your personal lives in order to minimize the risk of transmission and being exposed as much as we possibly can. If you have any questions, please reach out to your supervisor, manager, or myself, and we will do our best to get you answers. Please be safe, and we will talk to you soon. Bye-bye.